A middle-aged woman cured of HIV. It's according to a report in the New York Times, and it's the new transplant that made it possible. It's prompting a conversation about the possibility of curing HIV in more people of diverse backgrounds than previously thought. Dr. Kumar joins us this morning to discuss the new breakthrough and what this transplant means. Good morning, Dr. Kumar. Thanks for joining us.
Good morning, Leslie. It's good to see you.
Yeah, good to see you as well. So this is incredible. The third person ever believed to have been cured from HIV. Talk a little bit about the transplant. This was not done through stem cells.
Well, it was partly done through stem cells. So let's back up just for a second and talk about why it's so hard to cure HIV. HIV is a virus that we've talked about for 2 generations now. It's been around since the 80s. And what it is a virus that can lay dormant in our immune cells. And so normally when we use medications to try to kill viral cells that are infected with the virus, it's usually cells that are actively replicating that you can get access to. But if they're just laying dormant, any of the medicines that you use aren't very effective. And that's why most people that have HIV have to use treatment every day for the rest of their lives. Because if they stop treatment, then one of these immune cells that has HIV and is dormant can come back up and you have HIV again. And so of the few people that have been cured have been people that have had HIV, but also have had leukemia. And so they need a bone marrow transplant. They need to have all of their immune cells destroyed and then have new ones replaced. And they've tried that in the past and been successful just 3 times. What's interesting about this approach is first you got to have a donor stem cell. And there's 1% of Northern Europeans that are resistant to HIV, so they're good donors, but you can understand there's not a lot of donors that are going to cure your HIV. So you have to have a perfect storm of a person that's infected and whose cells are compatible with these Northern European cell lines. And such an occasion occurred. And what's interesting about this transplant is, unlike others in which they only used adult stem cells that had resistance to HIV and introduced them for the bone marrow transplant, this time they also used cord blood. If you guys remember when you had babies, when we had our 3 kids, we had the option of saving cord blood, but it was all too confusing and pricey, and we didn't do it. But if we had our cord blood of our children would be available, and there had cord blood of some of these people that were resistant to HIV, and cord blood, you don't have to have a good match. You can transplant anybody because it's so early, right? It came right from the newborn. So they mixed cord blood with adult stem cells and infused it into this patient, this woman from New York, and 3 years later, she's on no medications, has no HIV, and is resistant to it. So it's really an incredible proof of concept.
Yeah, absolutely. And so it sounds like it is not so much not the use of stem cells, like I said, it's more of where they're coming from and the availability, as you said, and that's what's offering more of the possibilities.
Yeah, no, this is, again, just a proof of concept. And while it's all over the news, as we see, we shouldn't think that we now have a cure for HIV. No, but it's really important because there's only been 4 people that have been documented to have HIV cured. But you got to make these small, gradual steps. And what's interesting about it is the addition of cord blood to adult stem cells, that combination. Right now, they say if everybody in America that was available for this kind of treatment got it and was cured, there's only be 54. There's 1.3 million Americans infected with HIV, and only 54 would be eligible for this kind of therapy. So because you have to have some kind of leukemia that warrants a bone marrow transplant, the idea of just knocking down everybody with HIV, their immune cells, and transplanting this kind of stuff is too dangerous and too risky. The risk of infection or complications or death is too high. And so this is not an HIV cure for the masses that are infected. These are for selected cases, but we have to have these selected cases be successful before you can transfer this kind of idea to the rest of the population. So it's really fascinating, and that's why it's making world news, because it's only the 4th time that it's happened. And the combination of cord blood, which you don't have to have as much of a match, with adult stem cells, which grow better than cord blood. They grow better in the bone marrow. And so that combination is really intriguing, innovative, not anything to write home about yet, but boy, it's making world news because it's novel.
Yeah, absolutely. Just incredible. All right. Well, Dr. Kumar, we appreciate your time. We are out of time this morning. If you have any questions for Dr. Kumar, you can email him and ask drkumar@gmail.com. Also check out his website, drkumar.com.